We are more than a year into the pandemic. We've learned a lot about COVID-19, but many of us still have questions.
Several have asked, can the virus be spread through money? Eyewitness News reporter Jeremy Baker and our Verify team find out.
There are several factors that come into play.
Our sources for this Verify are Dr. Fred Campbell, an associate professor of medicine with UT Health San Antonio, and the Centers for Disease Control and Prevention website. We want to verify COVID can be transferred through money. First, the bills.
It appears that the virus can live on objects in public for several hours.
And the coins?
About the same amount of time, maybe a little longer.
According to the CDC website, where they state what bank employees need to know about COVID-19, it says, as a bank employee, you could come into contact with the virus at your job by touching or handling items, cash, or paperwork, and then touching your mouth, nose, or eyes.
More important is the health of each person handling the money.
The only time it would be possible to transmit the virus from objects would be if the object was recently sneezed or coughed on by an infected individual and then transferred from that object to your mouth or nose.
We also took in a report by the Bank of England, which found 71% of respondents were using less cash than before the pandemic. 42% had visited a shop that did not accept cash in the previous months, compared to 15% this past January. And the value of cash in circulation has risen, with more people holding on to it out of uncertainty for the future. Dr. Campbell says the best way to protect yourself is to sanitize and wash your hands immediately after handling the dough.
So yes, it is true. The virus can be transferred, but the more time after the money is handled, the less of a chance the virus is still alive. Jeremy Baker, KENS 5 Eyewitness News.